Human papillomavirus, HPV, is the most common sexually transmitted infection. Many of us will get HPV sometime in our life. The infection generally occurs in sexually active individuals in their late teens and early 20s. There are over 100 different types, and some of those types are cancerous. When infected with HPV, many times the body will clear the infection within 2 years. Other times, it may take up to 2 years before the infection is detected, making it very difficult to determine the source. The virus itself commonly causes skin or mucous membrane growth known as WARTS. The virus can be spread from mother to child and through abrasions, cuts, and of course, sexual intercourse, penile, anal, and oral. There is currently no cure for the virus. However, there is a vaccine, Gardasil. Gardasil recommendations are routine vaccination, 11 to 12 years of age. However, it can be given as early as 9 years of age. The catch-up vaccination is age 13 to 26 years, if not adequately vaccinated. And there's also a shared clinical decision-making for some adults age 27 to 45, if not adequately vaccinated. HPV shows up on the skin as warts. It could be on the hands, the vagina, the vulva, the legs, the face, anywhere. Genital warts generally appear on the penile or penis, the vagina, and the anus. From the picture you see the very classic cauliflower pattern, which is what we generally see in the vagina and anal regions. They may also appear on the vulva and on the mucous membranes in the mouth area. The mucous membrane warts seen here are not always this dramatic or that you can see as clearly as seen in these slides. And of course, you have here in the anal region the very classic cauliflower pattern. So let's get into the different signs and symptoms. First, you have your common warts. Your common warts are usually rough, raised bumps. They appear on the hands and fingers. They're more commonly unsightly or unattractive. They are painful and they're easily injured and they easily bleed. Next, you have your genital warts, which are small, flat, cauliflower bumps or tiny stem-like protrusions. They generally don't cause a lot of discomfort. However, they do tend to itch and may be tender. Your plantar warts are hard, grainy, and usually are on the heels or balls of the feet. And of course, they're very uncomfortable. Your flat warts are flat-topped, slightly raised. They can generally appear anywhere, but most commonly in children, they're on the face. In men, they're in the beard area. And that's something that you really need to consider because today there's the trend of wearing the beards. And so the beards may cover up these breakouts. And most commonly in women, you see these on the legs. It is very important to remember that these warts are contagious and they're spread through direct contact as well as the warts themselves, touching them from skin to skin, as well as through sexual means. You can also get them by touching something that someone that has the warts touches as well. Remember, there is no cure for HPV. So if the body does not clear it, it can go on to become cancer. So once you have a cancerous lesion, how do we diagnose it? We diagnose cancer or cervical cancer by what we call acetic acid test or a vinegar test. And what we do here is we take a drop of the solution and put directly on the warts. And we're looking for the color change of white to indicate the virus HPV. For women sexually active, over the age of 21, I believe, we do pap smears. And the pap smear is looking for any type of abnormality in the vaginal region. We also take samples of the vagina in different places, and we send these off to be tested. It is both a direct visualization as well as laboratory testing. For women over the age of 30, it's an automatic DNA test of where these fluids are actually tested for the cancerous types of the virus. If cancer is detected, for example, in these pictures you see SIN 1, SIN 2, SIN 3. This is an intraepithelial staging. What do we do? Well, we could do a colposcopy, which is a biopsy of the abnormal looking area. We also can do the removal of the precancerous lesion, and we do that by either cryo surgery, which is a freezing type of surgery, laser surgical removal. We could also use LEEP, which is a type of electrocautery. And the third thing we would do is a cold knife conization. And it's also basically taking a big chunk of trying to take out the abnormal part and sending these, of course, for testing. These are pretty much the treatments. Treatments are not curative. Treatments are palliative or symptomatic treatments for the most part. So in summary, remember HPV, human papillomavirus, is the most common sexually transmitted infection, and it is a deadly or fatal sexually transmitted infection. You contact your physician or the health department so that you can assess your risk. And if you don't have a physician, you could always go to the health department to make sure you have your vaginal exams. Also, this video is for education and awareness only. It is not a substitute for advice or management. Once again, contact your physician or local health department for HPV education and management, as well as to assess your risk. As always, comment, subscribe, share the video, turn on the notification bell, and as well as comment below of any topics that you would like for us to discuss on this channel. If you don't feel like putting your information in the contact or asking a question, you can always look in the description box or somewhere in the comments, and we will have our contact information there. Thanks again for watching.